Hello, I'm Kendall with the Obesity Action Coalition, and on this episode of Fresh Perspectives, we'll be hearing from Sarah Bramblette about weight bias in healthcare. Sarah is an OAC board member and chair of the OAC's Access to Care Committee. She combines her experiences as a patient and healthcare administrative professional in her advocacy efforts to spread awareness about obesity, lipedema, and lymphedema, and to advocate for improved diagnosis, treatment, and insurance coverage. She played an integral part in the recent passage of the Lymphedema Treatment Act, helping millions of patients gain access to life-changing treatment. She also advocates against weight bias and stigma, specifically in healthcare and in the workplace. Here to share her story today is Sarah Bramblette. Thank you so much for joining us.
Thank you for having me.
So, Sarah, how did your journey of patient advocacy, particularly fighting for weight bias, begin?
My journey began more than 20 years ago. I was in my senior year of college, and my weight was finally affecting me. You know, growing up, I had always been of a larger size, but I always just participated in life. I, was in the band. I had friends, had a paper route. I just lived my life. But there became a time when I noticed I was getting, short of breath walking in from my car. My legs were very big and were weeping fluid, and I was just really concerned that my weight was having an impact on my health. So I sought out a new doctor to see because I was actually, I think my family doctor had retired. I know I was past the age of being pediatric, so it was time to find a new doctor. And the doctor I went to just initially just said everything was my weight. The issue with my legs was because of my weight. She quickly said she would refer me for bariatric surgery, and I was in my early 20s. I had never had any type of major surgery, and I also at that time never really had tried, small diets here and there, but I hadn't in my mind made a concerted effort. So I wasn't ready to just jump into what I considered major surgery, and where I lived would be far away. And so, but I realized at the appointment, she didn't have a scale to weigh me. So her concern, she was blaming my weight, but she didn't know how much I weighed. And I asked her, is there somewhere, anywhere in the town that I could get weighed? And she didn't know, and she didn't really seem concerned. And then she just gave me a paper diet, here, try this. And I had to be the one, I remember asking about, can I, would you send me to physical therapy so I can get some exercise, but that's monitored for my safety and so that I don't injure myself. And I knew the physical therapy also had a pool, but I felt why am I the one having to ask for this? If she thinks I should, if everything's a problem, my weight, why isn't she telling me or giving me things to do? But it really struck, and I really realized I had to advocate for myself was, I actually also saw a new OBGYN, and that doctor asked me what they were doing for my lymphedema. And I'd never heard the words, and that's what was wrong with my legs. And so that doctor got me help and got me treatment. And when I went back to my primary care doctor, who had just blamed everything on my weight and told her, they found the issue, it's lymphedema, and I'm going to get help, and I'm going to get a compression pump. She just looked at me and said, oh, I have other patients with that, and those pumps are really uncomfortable. And it was just an eye-opening moment that she knew what it was, but she hadn't told me, nor had she offered me help for it. And it just made me realize not all doctors are all knowing or all caring, unfortunately. And that I really had to be the one to demand things and speak up. And I certainly, found another doctor after that, because I realized that this person just really didn't have my best interest at heart. But that's just really when I realized I had to be my own advocate. I couldn't just trust what I was being told. I had to, ask for referrals, ask for other doctors, and really get the answers that I wanted.
Thank you, Sarah, for opening up and sharing that story with us. So what does weight bias look like in a medical setting and in patient-doctor interactions?
So to me, it's interesting because weight bias looks different. So in the medical setting, it looks like they don't understand how much you weigh, because you go into the waiting room and there's not adequate seating. There's chairs with arms on them. that you can't sit comfortably in. You go to have your blood pressure taken and they don't have a cuff that's big enough. They don't have a gown big enough for you. They have a exam table that's too high and they don't have like a stool or anything to help you get up on the exam table. So in that aspect, they act like you're the typical size of every other patient. Yet as soon as they walk in the door and you actually start having that conversation with the doctor, everything is about your weight. And disappointing enough is even when they see, like from example, I have, my labs are normal, like my vital signs are normal. They'll still look for something to connect, like your weight must be causing some issue, or for some reason, the reason you're there is related to your weight. Instead of just listening to us, especially they assume you haven't tried anything, or that if you're trying something, you're not doing it correctly. And that's disappointing not to be believed as a patient, especially at this point in my life where I have, undergone bariatric surgery, I've tried different medications, and they don't look at maybe the progress I've made. They still just see, like after I had bariatric surgery, I had lost hundreds of pounds, and I would see new doctors who would still only see me at my current BMI and make assumptions about things. And so that's just very frustrating because you're already limited the time that you have with a doctor. And I feel like it's sometimes wasteful having those conversations versus what I'm there for the current issue I'm having.
Thank you, Sarah, again for sharing that. Does sound very frustrating and very eye-opening to hear your perspective. So if you feel comfortable sharing, what is one interaction with a health professional that has stayed with you, and what can other health professionals take away from this to improve their communication with patients?
Certainly. And so I thought about this because, I've been navigating the healthcare system for more than half my life, and having, more than one chronic condition means I do see a variety of doctors. And, the experience I just shared with a primary care doctor when I originally sought help for my weight, that was a negative experience. So I thought it'd be good to maybe share a positive interaction I have, because I think sometimes people learn more by seeing how something's done right. We all know how it's done incorrectly or wrong. So I thought it'd be helpful. So I eventually moved to Florida and I saw a new doctor here in Miami. And I was transferring my bariatric care to Florida. So there was just a lot of things going on. But in the scope of things, I'd had a DVT, a blood clot in my leg. And then I was having some symptoms of numbness. And so the doctor was concerned. She sent me for a CAT scan. And she called me to let me know that the CAT scan did show some evidence of like a small stroke. And she was speaking to the radiologist and a neurologist to see if I needed to, be admitted for, this is her specialty. So she was deferring to the specialist to see if I needed to be admitted for evaluation or just follow up in the office. And she called me back and said that the neurologist she had spoken with, or the radiologist, one of the specialists, had said that likely the whatever evidence on the CAT scan was just due to my previous history with obesity and my weight. Like, yeah, I probably had a stroke at some time and it was just old and just due to my weight. And that doctor said, no, she's too young. She doesn't have the other risk factors. There's absolutely nothing that would say just she should, it was completely abnormal for me to be having a stroke at that age. So she sent me for a second opinion. And it turned out that I had been born, had a hole in my heart that had not closed after birth like it's supposed to. And that was the reason that I had what they called a mini stroke. But it was the first time, like if a doctor told me it's probably just your weight, I was just, used to that because I know, having obesity could be a risk factor for stroke, but that's also usually combined with other metabolic issues or age. And so it was just the first time I had a doctor like stand up against it. It really empowered me to stand up against it. And so she's still my primary care doctor to this day. And what I like is she doesn't, if, of course, with the lymphedema and things, there are issues that we monitor my weight or we, do try to keep it down because, of course, it affects my mobility. But she's just very, she looks at the other aspects, my labs and other things going on. And that just that's what's important to me. I'm managing what I can manage, and we know that there are some things that just aren't manageable. And what's also interesting is I'm currently taking some of the new anti-obesity medications, and it's the first time I've been interested in checking my weight at the doctor's office, because even after bariatric surgery, even if I lost weight, doctors would say it's not enough. Like if they expected me to lose 10 pounds and I only lost 5 pounds, instead of saying, great, you lost 5 pounds, they'd say, oh, you didn't lose, what we wanted you to lose. So it's always been a negative. And so this is the first time where it's like positive reinforcement. She actually refers to my weight reduction as successful, because I'm like meeting the expectations of the medications. And it's just, I realize in 20 years, I've never had that word used. And of course, other people would look at me and say, oh, your BMI is still in the range of having severe obesity, but there's a better understanding of these medications. And there's a better understanding of the other health conditions I have. And even though she admits she doesn't know everything about the other conditions, she's willing to learn. She just doesn't blame everything on, your weight or needing to lose weight.
Absolutely. Thank you again, Sarah, for sharing that positive experience. It's great to have a doctor that looks at the whole picture. So how can people begin to empower themselves in their medical care, and what advice would you share with an individual that's experiencing weight bias?
I know it's easier said than done, but to empower yourself is first to believe you're worth it. We are all worthy of health care. And I know it sometimes is frustrating, because there's issues with not only finding a doctor that will listen to you, but there's also the issues and the restraints of medical coverage. Healthcare, sometimes you don't have the option of going around to different doctors because you might be limited by who's taking new patients or who's in your network. But just remember, you are worth it. And in the long run, being able to manage your health and being the healthiest you can possibly be, there's never going to be perfect health, but being able to manage as best as you can be is going to be worth it. In the long run, you're going to feel better. And for me, it was, talking to others, understanding the conditions I had, understanding sometimes the assumptions that are made and what's right and what's wrong. Many times doctors will not want you to look up things on the internet, but we have to remember the internet also does have scholarly journals. It has, peer-reviewed journal information. If you have a doctor who's not willing to learn or listen, that's definitely a sign to find a new doctor. But just try to be that participant in the care. What are your options? A lot of times people don't realize they can ask questions. They can say no to something. If your doctor wants to give you a medication or recommend something you're not interested in, you can let them know that's not where you're ready to do yet. So, speak up for yourself, ask what your options are, and be kind of a partner in that decision-making process. And if something doesn't feel right to you, or you don't like the options you're giving, then try to find a new doctor. And sometimes, asking around your, not just maybe peers that you have on social media, but sometimes you can ask friends or coworkers who their doctors are, and maybe get a better idea of a doctor that you want to go see.
Thank you, Sarah, so much for your powerful advice and for all of your advocacy efforts. And thank you again for joining us today.
Thank you again for having me. And some ending notes, things are getting better, but it's certainly a long journey.